Hello guys, my name is Jane Beringan. I am a 5th student of Nursing Faculty of the Indonesian Development University. Now, I will explain what is xeroderma pigmentosume. Check it out. Have you ever had a sunburn? Small sunburn are caused by the penetration of ultraviolet radiation emitted by the sun. It usually occurs after several hours of exposure depending on the individual. The sunlight damages DNA in the upper layer of skin cells, causing a burn in the area of penetration. Usually, these burns last around 3 to 5 days and eventually repair themselves naturally. But have you ever wondered what the result would be if a person had xeroderma pigmentosa, or more commonly known as XP? Welcome to Demystifying Medicine, and today we will talk about ins and outs of XP. XP is a rare hereditary skin condition that affects 1 in 1 million individuals. It is characterized by an extreme sensitivity to UV rays from sunlight and the inability to repair cellular damage. XP is an inherited autosomal disease. This means there is a mutation in one of the 22 autosomal chromosomes. Typically, in mutation can cause a chromosome 3, 9, 11, 16, 15, and specific gene without them to import the sunburn repair mechanism, which we talk about. Normally, every cell in the body is known to have two versions of each gene, but a child with XP has 2 copies of the mutated gene. How did they get these 2 copies? Both the mother and the father each based on the 1 copy and the mutated gene, and the child in the order for them to have XP. So how about you come to know if you have XP? One of the most common and effective way of diagnosing XP is sequencing candidate genes to view if there have been a mutation. More than 19 of all XP cases are contained by mutation in one of gene: XPA, XPC, XPD, and XPV. And these are genes involved in the nucleotide excitation repair pathway, which we will talk about. The need to diagnose a disease that has numerous underlying genes present a challenge, especially since there is a little information upon XP, and new variants of gene continue to be identified. So, let's go back and see what happens when you get a sunburn. UV radiation penetrates the DNA on the surface of the skin and causes it to disassemble. Nucleotides, adenine, thymine, guanine, and cytosine are building blocks of the DNA strand that gets parted and fragments into an abnormal structure called dimers. Once this happens, the body's friction mechanism kicks in to repair itself. You can think of this similarly to a puzzle when you are solving a puzzle and try to fit 2 of the same pieces together. If it's an abnormal appearances and present you from solving the puzzle, and eventually you will have a separate inherit it. This is what a dimer basically is, two of the same pieces. In this case, the DNA nucleotides connect it together. So how are these abnormal DNA dimers repeated? The repair mechanism is carried out by nucleotide excision repair, which occurs in 6 steps using various enzymes and proteins. An enzyme is a tool that uses a specific substrate to increase how fast the region moves in order to complete a task. For example, you can think of a star-shaped screwdriver and an enzyme and a star-shaped screw as its substrate. What combination together, you can complete a task similar to the enzymes involved in concluding excision repair. First step in the recognize the DNA dimers by the XPE and XPC DNA binding protein. In the second step, a protein called XPD helps enhance the DNA XPA, RPA, and XPC transcription factors assemble to form a stabilized pre-incision complex to allow for an incision even to occur. XPC calls upon an endonuclease SPG which cut in the site of mutation. XPG cuts in the 3' end to the DNA and the another endonuclease XPF cuts in the 5' end of the DNA, forming an empty gap between the start. The gap is filled with newly synthesized nucleotides in the appropriate base pair matching sequence by DNA polymers. Finally, the newly synthesized sequence in between the gaps are shared with an enzyme called ligase. And then DNA replication can occur to the sunburn health. Patients with XP lack their repair mechanism, enzymes, and protein to the genetic mutation, and they are unable to repair even the smallest sunburns. The damaged DNA on the skin of XP patient can turn cancerous and spread through the body, which may eventually lead to death. Some symptoms of XP include dinners of the skin, chinking of the skin, premature wrinkle of the skin, checkered pigmentation, and dilation of blood vessels under the skin. Currently, there are many experimental trials and attempts to resolve XP. However, there are ways in which to manage the disease in the meantime for patients. The goal of management in patients with xeroderma pigmentosume is to decrease the number of malignant tumor and the patient develops. It is because XP patients lack the necessary DNA repair enzyme and they are very susceptible to skin cancer. And a side note, cancer is abnormal cell division, and in this case it is the UV rays from the sun. In XP, patients causing their cancer, the most effective method of decreasing the number of malignant tumors in patients with XP is strict sun avoidance, staying indoors, and using protection such as protective equipment including sunglasses and umbrellas. There are many creams that act as an extreme form of sunscreen, such as Photolis. This does the job, along with repairing damaged DNA. So firstly, we learn in xeroderma pigmentosume, which is commonly known as XP, is a rare hereditary skin condition, commonly characterized by an extreme sensitivity to UV rays from sunlight. We learn how it can be diagnosed from an individual. We also learning how XP developed due to a lack of repair mechanism eczema due to genetic mutation which are unable to repair even the smallest sunburns. We learning the variety of symptom association with XP, and lastly, we learning that there are many experimental attempts being made to aid in this disease, and there are ways in which of